Good afternoon. My name is Michaela Etheridge, and I'm a student nurse at the University of South Alabama's College of Nursing, and this is my soap suds enema procedure. So here's my ID. And scan them in. So the first thing, I've already verified my patient and verified the hospital policy and procedure in the NG tube video and the allergies, so I don't have to do that. And I have already gathered all of the equipment that I need for today. So I have my enema bag and soap, my gloves, goggles, wash rag, towel, and my waterproof linen and the water-soluble lubricant. And I would need a bedpan, but I don't have that. So I just have a picture today, and I would need an IV pole to hang my bag on, but I'm just going to lay it on a hard surface. So I'm going to wash my hands and don my goggles. And we're going to fill up our bag with 750 to 1,000 milliliters of warm water or normal or saline for an adult. So I have clamped the tubing and I'm going to fill my bag with water. So that's about 750. And we'll now add our soap in. And we're going to gently agitate the bag to mix. Once it is mixed, we will unclamp the tubing and prime the tubing. So once you have primed the tubing, we'll reclamp and set the bag on a hard surface. Then I'm going to go back to the patient's room or back to the patient's bedside. I'm going to perform hand hygiene. I'm going to raise the bed to a working height and lower the side rail, and I'm going to place my patient in left lateral stems position. Then I'm going to perform hand hygiene and put on my clean gloves. Once I have on my clean gloves, I'm going to grab my tube with my dominant hand, and I'm going to lubricate the end of the tube. And I'm going to, with my non-dominant hand, I'm going to gently but firmly grab the patient's hip and tell them that for this procedure they're going to need to take slow, deep breaths. With my non-dominant hand, I'm going to spread the buttocks, and with my dominant hand, enter about 3 to 4 inches in. I'm going to hold that, and if the patient had hemorrhoids, they would need to bear down to facilitate the insertion process. So I'm going to grab my bag and unclamp the tubing and raise the bag 12 to 18 inches. If the patient had cramping or felt uncomfortable, I would lower the bag or clamp the tubing back and just tell them to take deep breaths while the procedure is happening. Once it is done, I'm going to remove and discard of that. I'm going to tell the patient to wait and hold that for about 15 minutes. I'm going to get the bedpan, and I will place them on top of the bedpan, the bedside commode, or the commode in the bathroom. So I place them on it and leave it there until they are done evacuating. And then for this, the patient's buttocks will go on the larger part and the thighs will go on the smaller part. And then once the patient is done evacuating, I would remove that, and I would then go and take my gloves off, perform hand hygiene, and document. So I'm going to document the amount and type of enema, the time it was given, how the patient tolerated it. I would document the amount and color of the return, and how I left the patient when I left the room. And that's all.